Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, algorithm in a bleeding peptic ulcer. So, if a patient comes with bleeding peptic ulcer, the first thing which you have to see the stability. Is the patient hemodynamic? So, first thing which you have to see in case of bleeding peptic ulcer is whether the patient is okay. First thing which you have to see in a bleeding peptic ulcer is whether the patient is hemodynamically stable or not. Okay, now if the patient is hemodynamically not stable, if the patient is hemodynamically not stable, then what do? If the patient is hemodynamically not stable, then you will see the BMI of the patient. If the BMI of the patient is 21, or if the patient has difficult duodenum, okay, then in either of these conditions, first you will see no, if the patient BMI is normal. Then, if the patient's BMI is normal, then it is most commonly a duodenal ulcer. Because in duodenal ulcer, the patient will eat properly, right? Because of good appetite and there is no pain. Pain reduces after eating. So, as a result, the patient eats normally. So, his BMI is normal. Then, in such cases, you will have to repair or suture the bleeding vessel, which is most commonly gastroduodenal artery in this case, and do a truncal vagotomy can be done with pyloroplasty can be done in these patients. Pyloroplasty is done in these patients. Okay, this is when the patient is hemodynamically stable and has a duodenal ulcer. Now, if the patient's BMI, if the patient is hemodynamically stable, sorry, this is hemodynamically unstable, that means the patient is hemodynamically stable. If the patient is hemodynamically stable and if the BMI of the patient is less than, if the BMI is less, now if the BMI is less than 21, that is if it is yes, then even then it is a, if it is yes, then there are two possibilities are present here. One, it can be either a duodenal ulcer, because here the patient has difficult duodenum, or it can be a gastric ulcer also. It can be a duodenal ulcer or it can be a gastric ulcer. Okay. Now, if the patient has a duodenal ulcer, obviously you will have to repair the vessel. Now, if the patient has a gastric ulcer, then what do? You will have to do a biopsy and repair the vessel, and you will also do a wedge resection is also done in case of gastric ulcer. Okay, even if the patient is hemodynamically unstable, if the patient is hemodynamically unstable, yes, then it can be either duodenal ulcer or gastric ulcer. In such cases, you will have to repair the vessel and do a biopsy. And you have done this. After this, if at any stage, if the patient has rebleeding, okay, now here it is yes. Now, if the patient has rebleeding, in any stage, if the patient has rebleeding, and now if the after rebleeding, you will have to see what is the ulcer. Now, if after rebleeding it is a duodenal ulcer, you will do this procedure. That is, you will suture the bleeding vessel and do a truncal vagotomy and pyloroplasty. But if the patient, if it is a gastric ulcer, now you will see what type does the ulcer belong to. If the ulcer belong to a type 1, 2 and 3, then what do you do? If it belongs to type 1, 2 and 3, in such cases you will do a gastrectomy, that is distal gastrectomy is done. If it belongs to type 1, 2 and 3, then distal gastrectomy is done. But if the ulcer is actually a type 4 ulcer, in such cases we can do either a sense procedure, sense gastrectomy can be done, or we can do a Pochet's procedure, or you can do a Kelling Madlener procedure can be done. So overall, if you see, we have, see, I will explain everything now within a minute. Okay. See, there are two things. One, whenever there is a bleeding peptic ulcer, then you should see whether the patient is hemodynamically unstable or hemodynamically stable. If he is hemodynamically stable and his BMI is normal, then if it is a duodenal ulcer, then you will do a bleeding vessel, you should suture it, and you do a truncal vagotomy with pyloroplasty is done. Second, now if the patient is hemodynamically unstable, or if the patient has a BMI of less than 21. So even if the patient has less BMI, then he is not ready for surgery immediately, right? If the BMI is normal and the patient is stable, we can do a proper surgery, truncal vagotomy with pyloroplasty. But here, if the patient has BMI less and if the patient is unstable, he is not ready for surgery. You should first resuscitate the patient. So for that, you will have to first repair the vessel. So in duodenal ulcer, you will repair the vessel. If it is a gastric ulcer, you will take the biopsy, because gastric ulcer has a chance of malignancy. So to uh, rule out the malignancy, we will have to take a biopsy and you will have to repair the vessel, and if wanted you can do wedge resection also, and then you will send the patient home and ask him to gain his weight and make, and or you can put him in the hospital to make sure that he becomes hemodynamically okay, by giving fluids and everything. And later, if the patient rebleeds at any stage, then if it is a duodenal ulcer, you will do a definitive treatment, that is truncal vagotomy and pyloroplasty after suturing the bleeding vessel. Or if it is a gastric ulcer, then the treatment depends upon the type of the gastric ulcer, that is type 1, type 2 or type 3 gastric ulcer, you should do a distal gastrectomy. If it is a type 4 gastric ulcer, then you do a Sen's gastrectomy, Pouchet's gastrectomy, and Kelling's Madlener gastrectomy is done.
Thank you and thank you for watching.